When you ask a question, we're going to have a microphone come to you, so we'll need for you to just raise your hand. A number of excellent suggestions. The idea of mentors. You are a mentor, Samantha. Okay, thank you.
I'm just curious, what state were you in? You said you moved here?
Yeah, does this work? It does. Okay. Okay, can everyone hear me? Okay. So I was born and raised mostly in Northampton, Massachusetts, but I moved to Michigan when I was 14, and did a couple years of middle school and high school and in Michigan. Yeah, and I was in Lenawee County, in case any of you are curious about that.
We have an unusually quiet audience. I think we're contemplating what was shared here today. It's moving, it's profound, but I think also there were so many suggestions on how you can make a difference. There are some things that you can do to help out. Support for young families seems to be absolutely essential.
I'm wondering if any research has done or if there's any statistics available as far as kids entering the child welfare system due to lack of mental health services in the home when they're young?
I don't think this doesn't mean they don't exist. I don't think I've seen it framed quite like that. You mean lack of mental health services for the child or for the mom or the dad?
For the child. Are families giving up their rights to the children so they can access
okay.
mental health
Yeah, so there is quite a bit of literature out there. So what we do have is we have sort of this misuse, but it's not misuse like somebody did something wrong, it's just people are put in desperate situations. So some families where there isn't abuse or neglect going on, but they have a child who has a serious mental health problem, and they don't have the health care or the resources to get the level of treatment for their child that they need, will sometimes willingly put themselves in the child welfare system and all of the craziness that comes with that, simply as a desperate move to get treatment for their child, to make sure that they get residential treatment often if that's what's needed for their mental health care. And that's obviously problematic. It's not what the system was created for, but it's a sign of the times that we have families that desperately need a level of health care that they can't access.
I got a question.
The mic then.
One second, we're on our way. Sorry.
She's coming. Yeah, she's coming. Good afternoon, State Representative Betty Cook-Scott. I got in at the end of your presentation. Are any of the kids tracked by the state of Michigan once they leave, age out of foster care? And which benefits do they lose right away when they age out? And is there any wraparound services to get them to the next step? Automatically housing, we talked about health care, just coming into the adult population. How can we as state officials assist the foster care system? And is there any legislation that needs to be written to assist them?
Thank you, Representative. I think that there are also people in the room that can help answer this, but there have been some positive steps made federally in terms of trying to get rid of some of those cliffs out of foster care. So there's services available in certain circumstances till age 23 now, health care. So the Medicaid issue is a tricky one because we actually made a decision federally pretty recently that kids needed to be covered by Medicaid that were in the foster care system up to age 26. And now we're like sort of going, well, in Michigan, maybe, as long as they're working, whatever. So it's a little inconsistent. But, so there are services available post-18 and some things that are trying to remove that cliff. The piece that Michigan's Children has been interested in is how some other states, because they have some flexible funding, so we tend to fund everything dependent on federal sort of rules and dollars, there's actually, so kids need to leave. I mean, it's not like they physically leave. So they're out, they're funded differently. Their services are funded differently up to 18 through a different pot of money, federal money, than after 18. And some states actually have a much sort of smoother sort of opt-out versus opt-in kind of thing. Young people actually have to opt in. And they're given, you know, there's social workers, people are telling them to, helping them to, but they have to opt into services after the age of 18. And other states make that a little bit smoother process. There's many things, and I think we'll all be interested in talking more with you about that, for sure. Does anybody else want to?
Because I represent Grosse Pointe Park, Grosse Pointe City, Grosse Pointe Farms, and then Detroit, all the way down to the boulevard. So I see, you know, this roller coaster. And so I would really be interested in you all coming to my office or me coming to you to see which policies that we can change. Okay?
Can I just add one more thing to that? Along the lines of what we were talking about, where kids go home, even if they're put in foster care, they go home once they age out of the system. And so I think thinking about what sort of what got people there in the first place is also a way of addressing successful transition. One of the things I had to limit my suggestions. I didn't want to overwhelm you all, but had I had room for one more slide, another suggestion I would have made is to have this state start to invest, even on a pilot program basis, in some of the evidence-based neighborhood interventions for preventing child abuse and neglect. There's one in particular called Strong Communities that has been carefully and rigorously evaluated and has been found to be very effective at reducing rates of child maltreatment, child welfare system involvement within specific neighborhoods. And we know for various reasons that child maltreatment and child welfare system involvement clusters geographically, right? And so anybody who's worked in the system knows there are just some neighborhoods you spend a lot of time in, right? And so I think in particular when we think about what's happening at a neighborhood level, forget the family for a second, but what's happening to our communities that are getting stripped of resources, right? And find themselves embattled with police and in situations where people no longer trust each other, lean on each other, etc. That's a huge part of the problem, and there's lots of research that shows that that contributes to child maltreatment risk. So we now have programs that actually, they don't go in and try to change families. They go in very effectively and they change entire neighborhoods. They change the norms of the community members that work there, and they help residents start to feel, have a sort of a value around supporting each other and figure out how to do that and have a sense of what we call collective efficacy, which is basically, you know, having confidence that you can actually make the world look something like you hope it to look like. And so that's another thing that I'd recommend, and I see that both as prevention, but honestly also as transition, because these are the neighborhoods a lot of these kids are coming back to.
I have a question for Michelle. You have a lot of good strategies and initiatives in your presentation. Can you tell us, or do you have information, which states are doing what? Are doing more than what Michigan's doing? What states can we look at as good examples of implementing these kinds of things?
Honestly, I don't have that at my fingertips, but some other people around the tables may. And we could definitely try to make some of that available post this session. Linda might have some in mind. Other people, Sash, might have some in mind.
I'll just add one, because Linda and I were actually just talking about it before the presentation. So the largest child welfare system in the country is Los Angeles County. They actually, within their child welfare department, have an early care and education manager whose entire job is getting kids in the system, young kids in the system, enrolled in Head Start and other high-quality preschools. And he did that by creating an app. So when their social workers log into their computers, in the morning, they will say, good morning, Sasha, the following kids on your caseload are age eligible for preschool. Click here to refer them. And if they click and refer, they don't have to fill out any forms. Caseworkers in the child welfare system are notoriously overworked. They don't need to be filling out more forms. Instead, it pulls out of the database that caseworkers use all the information that's needed to process a referral and essentially does that for them. It's just one example of how, if we think creatively and borrow these best practices from other states, we could make an amazing difference. When they started to expand that system and roll it out, the rates of kids in their system that were getting into preschool increased dramatically. And that's something that it's an incredibly inexpensive, simple, elegant solution that we could easily implement here in Michigan. So that's just one example.
I just want to follow up on that too and circle it back to part of what I was saying before, is that'd be great if we had a really simple system to refer people to childcare, if we have childcare. So it's sort of like this, it's all together. These best practices in states around child welfare and foster care, and then best practice investments in what the support systems are around that to take place too.
Yeah, I want to mention the under-resourced system issue and the role of Michigan in that, and perhaps also even the role of the Mackinac Center in terms of its personal responsibility agenda, its market-driven agenda, its limited government agenda, and if the dominance of that policy influence is at the core of some of these systematic elements, is it a matter of lobbying policy that you already know work, or is it a matter of electing people that are going to advocate for those policies? Which is a better strategy?
I was going to say, so I should probably take that one. I think, so what I would say, a couple of things. One is that it's actually counterproductive to disinvest in these programs. And Sasha talked about that. There's endless research about early childhood investments, about it just is like, duh, if you have somebody that can actually make it through post-secondary, they're a hugely higher contributor. It's not like rocket science, this idea of investment. So I think a piece of it is messaging with policymakers, right? It's about what are the issues that you're concerned about, and how do improvements in these systems actually get you to solutions that you're talking about. I mean, Sasha was talking about this whole idea of prioritization of child welfare because it's pervasive. If you're trying to figure out how you're going to improve employment in your community, well, you probably ought to have that 12.5% of kids somehow ready to go for employment, right? I mean, there's sort of, I think we haven't always messaged the system. It's sort of like, we're so sad for these kids, or even we're kind of sad for these families, but there's plenty of ROI, return on investment here too. So I would say there's that issue. And as Michigan's children, I would always say, yes, we need to be paying attention to what policy, we had a policymaker stand up and say, I am super interested in this, help me get more information about that. Awesome. We have to be paying attention to the people who are interested in this and thinking about how we build that capacity for other people who are interested in this. We have one of the biggest, we're going to have a huge shift, huge sea change this year in Michigan with a new governor, lots of new legislators, lots of opportunity to start trying to have a different, more productive conversation about investment. As long as we're all involved in that conversation in a way that policymakers can accept and understand. Originally when I was talking about sort of information that they need to know, that's part of it, right? If we know that what they're interested is in this, then that's the kind of space that we need to be taking the conversation. But I would also say, don't get me wrong, we've completely disinvested in the state. We've completely disinvested. And so we need to shift that. That does need to shift if we actually want to get to some better outcomes for kids and families.
I will add, though, I don't think this is inherently a partisan issue in any way, shape, or form. So when I was in my 20s and I was getting trained to be a child protective services worker, we had a sheriff come and train us on how to spot, when parents were on meth, or we had walked into a meth house. And I remember him starting his presentation and saying, look, let's be really clear, right? I all know what you think of me. Right? You think I'm this, gun-toting, law and justice, this and the other kind of person. And, I think you're a bunch of bleeding heart, liberals, et cetera, et cetera, et cetera. And that's really just fine. Because if anybody, rings the phone for either of us and says, I've got a kid and they're in danger, we are both going to be responsive to that. So I think the conversation that needs to, these types of conversations where we start to make it clearer that we just need to be aware that when we are trying to hold parents accountable for not taking advantage of a system, things like that, that those parents come with children. And I don't think anybody, regardless of their political persuasion, is saying, oh, that little abused 5-year-old, they need to pull themselves up by their bootstraps and show some personal initiative, right? I don't think, we understand that that's not reasonable. So a big part of it is, I think, our ability to kind of see the interconnections, have these conversations, and understand how to frame the issues. I just don't believe that anybody doesn't care about, hurting kids who've been abused and neglected and stopping that.
Hi, I've been a foster parent for almost 6 years. This summer will be 6 years. And I just want to echo what Sasha had mentioned, and it's really clear that all of you guys feel passionate about. A lot of the kids who have come to our home, and we have fostered 11, may have had a really good chance at an opportunity to stay home if there would have been preventative measures in place. I'm lucky enough to have been part of a reunification, which is 3% of cases in Michigan currently, which is so sad. And I'm still friends with the parents, and we don't co-parent because they've got it now. They fixed their issue and they were able to move on. But I'm still in touch with the kids and spend time with them, and it's so fabulous to see them by accident out at the movie store, or by accident at the Sparrow, Michigan Mile, because they want to take their kids to these fun activities that are in our community. So I just, echo to anybody who can put those preventative things in place. I know that the Alliance for Children's Trust and Prevention has an incredible framework called Protective Factors, and if that was more prevalent within the state of Michigan, I think a lot of the children wouldn't necessarily have to be traumatized by going into foster care, because we could start at the root cause.
Thank you. Samantha, what is ETP?
ETV is the Education Training Voucher. It's a stipend provided through Lutheran Children's Services, Lutheran Social Services. And it's a scholarship opportunity that allows any child who is in the foster system after the age of, or by the age of 14 or 13, to apply for up to $2,500 a semester. And basically, as long as you were in the system, as long as you had a full-time status, you can receive that scholarship, and as I mentioned, use it toward living expenses, school expenses. If you have children of your own, you can use it for childcare. as long as, you know, you're going to school yourself. So, yeah. Could I use this moment also to make a shameless pitch that I meant to do in my presentation and got ahead of myself? I don't know if any of you have heard of the FAME program at Michigan State University, and there's many programs like it at other universities for anyone who's not local to this area. But I mentioned mentor opportunities and how important that was to me in being successful. So maybe some of you are wondering how you can get involved with being a mentor. And FAME takes mentors. It can be anyone. Well, actually, Sasha could tell you more on that. I was very lucky with my mentor. It was Sasha Klein. And yeah, I've just heard that they're low in mentors. And it's a program run through Michigan State. Like I said, ask Sasha if you have more questions. But it's a priceless resource. I mean, I mentioned a couple things that I don't know if I would have made it through my higher education if it wasn't for blank, but I mean, Sasha's one of them. And I know the foster youth who sent me that quote about Medicaid, she had a mentor through FAME, and she attributes her success to that mentor. So look into being a mentor for FAME if you are interested.
FAME, F-A-M-E.
Yeah.
Anne Marie, can I just say, I was just thinking about the tie between what you just said and what Arnie asked about best practice in other states. Actually, I think that our college support programs, our college success programs, our network of those things are quite amazing and nationally recognized. So part of what we always need to do is actually look at where there is positive practice in our own state, and then actually make it available to everyone. So I think I just said a little bit ago that we have to stop, when I was talking more informally before, that we have to stop funding college access programs either by big rich dudes, sorry, all big rich dudes, or bake sales. And we actually have to put some resource into them. And so FAME is an amazing program. There are amazing programs. CETA Scholars, amazing. Blaven Scholars, amazing. And there are also amazing programs that have very little money at Eastern Michigan, at Lansing Community College, you know. So part of it also is this idea of actually looking at what goes well here, and then figuring out how we are better supporting it so that every kid can have access to it no matter where they live and no matter what they're doing. So, sorry, thanks.
This question is for
Last
Samantha.
question.
This question is for Samantha. Tanya Griffith with Oakland University. Can you talk a little bit about your experience as you transition to higher ed, and what do you wish the university had provided to you to make your transition easier?
Yeah, definitely. So I already mentioned FAME, which was an amazing resource. Actually, I don't think I would have, honestly, sorry for fans in the room, gone to Michigan State if it wasn't for FAME, simply because FAME is the resource, they're the people who helped find the scholarships for me. I mean, that wasn't just like an easy gift that was given. I mean, I had people advocating for me through FAME that made it possible for me to afford my education. I will say the CETA Scholars Program, which is through Western Michigan, I was looking into that as well, and something they did that FAME kind of does, but that is really important. They provide, like when you first come to school, they have bedding for your dorm. They have toothpaste and toothbrushes. They give you flyers to show you exactly where the food pantries are. And I think this information isn't just like handed to you when you turn 18 and age out, right? A lot of times you have to find it for yourself, and you're busy doing other things like trying to apply for Medicaid. So I think programs like that, like the university saying, here are the basic needs that can help you blend in a little bit better with your roommate who did not grow up in the foster system. And just scholarships. I know that sounds so simple, but I can't tell you how many scholarships I've received over the past 5 years, and every time I get one, I happy cry. I mean, no matter how big the scholarship is, because it really made a better quality of life possible for me.
Can I just say one thing I remember from Sam's experience is that there was quite a bit of resources here in Michigan for an undergraduate education, which is fantastic. But when it came time for her to apply for graduate school, there was almost nothing. So John Cita, who couldn't make it today, I mean, he literally like wrote a check to pay for some of her grad apps, so she could even afford to apply to graduate school. So one thing where we could grow and do maybe a better job is when we have kids who fight that hard uphill fight and graduate and get a college degree and want to go on and get a graduate education, that we also find resources to support them at that level as well.
Well, here's your short list of things to do. Support young families, support young parents, early intervention, must have early intervention, home visit program. The home visit program, the difference that can make was so significant. 22% decrease in child removal. Is that right? Neglect and child neglect. 22%. Home visit programs are an important piece to add to your to-do list. Preschool cuts it in half. Drug treatment, child care assistance, preparing foster care parents for caring for traumatized children, which is a new one. Let's see, ongoing health care, helping to provide ongoing health care for our first foster care children. Finding mentors was obviously a big piece of it. Talking with your neighbors and building a neighborhood, a community that supports the children in the neighborhood, and quite frankly, the parents. The picking up from school is an important one. I remember to this day, my house was one of those, the Schneider boys. We had kids that, when I picked them up from school, I had at least 3 kids I may or may not know in the car. And there was one boy who would always say, "Mrs. Schneider, I love your pizza." It was from Domino's. Right? It was from Domino's. But I said, you can come over for pizza anytime. So that's a fond memory I have. The ETV stipend is an important piece of this. Obviously, healthcare, food transportation, supporting one another, supporting neighborhood growth and a real community within your neighborhood. These are all on your short list. And the reason, and I don't take great notes, but those are pretty good pointers there. I had mentioned that we were going to put these presentations on our website. And it was also noted that we have an election coming up. This is a big new class of legislators. And so we need to be prepared. You need to have your list. You need to refer to these PowerPoints and if this is important to you, make it known that it's important to you, and be prepared to talk with our incoming legislators, our incoming policymakers. So I thank you for your time today. I'm going to ask our panelists to give you their takeaway from this forum today. Michelle?
I think that my takeaway is, as always, is that everything that we do has to be have the benefit of lived experience. We have lived experience as a foster parent. We have lived experience as a young person, and that just helps us figure out what our priorities are and how we can put things together. And obviously, Michigan's Children can be a resource to everyone as we move forward.
I think I'm struck by the fact that we know how to do this. Like, we can do this. There was a time in the field where we really didn't know. We were kind of shooting in the dark. But at this point, we know a number of ways to help prevent child maltreatment and prevent families entering the foster care system, and it's really just a matter of will.
Something that continues to shock me is how we've talked about a lack of resources, just a lack of funding. Like Sasha had mentioned, this has a rippling effect to many other issues. So I think there needs to be more interest in providing funding and creating programs for both families to prevent placement and removal, but also for kids to successfully transition out of care.
Okay. Can I get a round of applause for this May forum ties up our forum series for the spring, but we'll be back in the fall. I had mentioned that these presentations are on our website, but so are all of the forums, all of the forum presentations, and the panelists. If you need to go to them for some sort of expertise, or you want to include them in your conversations, they're posted on our website. And we covered everything from early childhood to support for communities, broadband in communities. We've covered how to care for the Great Lakes. What are the number one, or number two, number three kinds of things that we need to be doing to support our Great Lakes. So there's a wide variety of topics there that have been in the middle of the policy discussion throughout the year. So check it out. They're accumulated over time, so you have a number of years worth of forums there. If you have ideas for forums, I hope that you'll note those on your evaluations, and that'll help us see what's on your mind and what you're thinking about. So for now, thank you for being here and being part of this forum. If it's your first or if it's your 20th or whatever, I really appreciate your attention, your caring about these topics that are important to Michigan, and we hope to see you soon. Thank you.